This is Metabolic Mastery, a KORR Medical Technologies podcast dedicated to advancing knowledge and practice in metabolic testing. Welcome to Metabolic Mastery, brought to you by KORR Medical Technologies. I'm Dr. Marc Humbert, and this is my co-host, Dr. Garber. And today we're going to be talking about exercise programming for those who are just starting off on their fitness journey. And we've been thinking about this topic recently. We were recently on the OMA podcast, so that's the Obesity Medicine Association podcast. And then Cameron was actually at the OMA conference last week, and he had questions similar to what we're going to talk about pop up quite a bit. And so we figured this was particularly relevant to talk about.
I at the conference received a lot of questions about exercise and things. Normally, the interest within obesity medicine providers is typically been more with just getting that resting metabolic rate. And very helpful number, obviously, we're big fans. But it was surprising how much the conversation turned toward, does this machine do VO2 max testing too? And wanting to know more about the exercise components of things, because I think that's a big gap, both in most physicians' education. In medical school, unfortunately, there is no education on exercise programming. Exercise, physiological response to exercise is very minimal. And so that's something that I think many perceive as a gap and make it very hard to approach or talk about, because it's hard to talk about something that you can't field questions about when asked specific questions. Often, if you don't know specific answers, you feel kind of awkward, and nobody likes to feel dumb. And so a lot of providers maybe don't address that as much as they should, because they're just not sure what the right answers are necessarily. And so very often we tell patients to exercise. We tell them that it's important, and we give them general recommendations, but nothing specific to them, and very little that's really helpful in helping them to create a lifestyle that includes physical activity and movement and exercise, and doing so in a meaningful way that builds toward a healthy, active lifestyle. And so, that often becomes a problem.
Well, and in a vacuum, when people have gotten the advice, you need exercise, but they haven't gotten an exercise prescription, then they'll look for it in a bunch of different places, and some more effective than others. Social media is often kind of the first line of defense, if you will.
Yeah.
You know, what does my favorite influencer do?
Or gym class.
Yeah. And or what does my best friend do? And the difficulty is exercise programming is contextual. We like to talk about as if there's one ideal exercise program, this is what everyone should do. But there's actually just so many different factors to consider in any individual's life, different contexts, different restraints, different, perhaps injuries or other considerations to be aware of that changes the game. And so what worked for one person in one context doesn't necessarily work for someone else in another context. And so I think the other thing to understand is, and we'll get into this, like, what are some of the basic principles that, if we can understand those, like, that will help us to start right, so that we can, develop a plan that works for individuals. And so there are so many different modes of exercise, so many different ways to implement the concept of exercise. And so what happens is people often think like, oh no, this mode is the best, or this way is the best, right? I've got to only do HIIT training, or it's got to be only high load training, or only low load training, or whatever. And the bigger principle is, like, we need progressive resistance exercise, right? We need cardiovascular exercise that builds a base and that also challenges us sufficiently to build kind of those top end things like VO2 max, speed, neuromuscular efficiency, things like that. And so it's not just one thing that's going to do things. It's understanding what are these basic principles. Like, we need regular exercise, both aerobic exercise and resistance training, and we want to hit all those different qualities. And it's I think we just get too narrow that there's only way. We do the same thing with diets, right? This is the best diet because it worked for me. And one of the things that we do as individuals is we like to evangelize the things that we like, right? And so,
big time.
like, what's the last thing that you really loved? Like, did you go talk to your friends and family about it? Like, oh, like I read this awesome book. This is so good. Or, oh my gosh, you've got to go see this movie. So like Project Hail Mary, that was one that I was like telling everyone about. Oh, you got to go see this, right?
Yeah, it was a great movie.
Love that movie. And so we tend to just get really excited about the things like that, and we want to share them with people, and that's great, right? Like that's just part of being human and having social interaction. But the difficulty is, especially in things that come to our body and our own experience, right? This is my experience with this diet. This is my experience with exercise programming. We end up generalizing that to everyone.
Yeah.
And while it's understandable, it can actually lead us to do things that are less effective and end up having us spinning our wheels.
Yeah. Yeah. And so the idea with creating a good kind of fitness and exercise plan, wellness plan for somebody that's just starting out with fitness, and especially somebody that's got a lot of comorbidities like obesity, is we don't want to put the cart before the horse. Often we like to start out with, here's the laundry list of all the things that you should be doing. We look into the future and think, okay, they need to be exercising this much, and they need to be having this much protein and this much this and that, all the things. And it's like, man, if I go from what I'm eating in protein now to, 2 grams per kilogram of body weight per minute in protein, or per minute, that's fun.
That's insane.
The kilograms per minute is your VO2 max, oxygen consumption per kilogram body weight per minute. My bad. I added that
so
in.
Much protein.
So much
you would have a hard
per
time.
minute. You would have a hard time. But the 2 grams per kilogram of body weight per day, if we're putting a time stamp on there. And so, doing that compared to what they have been eating, you'll often cause other problems like restroom problems and things like that if it's too drastic of a shift. And so getting to that 1.6 to 2.2 grams per kilogram per day is something that is a process, right? You have to allow their lifestyle to catch up with that as well, because restroom issues, logistical issues of how do I make enough protein and get that into my diet and do so in a healthy, sustainable way. That's the key. So we like to talk about, whenever we're programming for people and doing stuff, we want it to be very low barrier of entry. We always say with any new goal, anything we're adding in or removing, either way, we want them to be 90% confident that they'll actually do it. So we may make a more micro goal of like, okay, we're at 0.6 grams per kilogram of body weight per minute. Let's bump it up to 0.8 per minute. I said it again. That's so funny. Per day. Anyway, so it's just making those micro goals. So we may say 0.8 or 0.9 or whatever, but making it doable. And so that's the idea, is thinking about that person and their lifestyle and life. And we like to zoom out often and think of the 30-year plan. Here's where we want to eventually be. And so I like to help people set expectations and say, okay, here's the 85-year-old you want to become. You want to be able to go on trips and put your luggage in the overhead bin. You want to be able to lead this healthy, active lifestyle. So in your 70s and 80s, what are the things you want to still be able to do? You still want to be able to interact and play and have fun with your grandkids, and you want to still be able to go on trips. You still want to be able to be you, or maybe even better than who you are right now in terms of a physical activity standpoint. And so we need to set those expectations that that's a process, that's not an overnight, that's not just a decision that you make today and then you have the willpower to stick to that. That's not quite how it works. All of those things, becoming active and doing a lot of, exercise or just recreational activities that you enjoy, if you're not currently doing that, that's a major shift in your life and lifestyle. And that's going to be a shift for all of those who love you and care about you. All the people within your sphere of influence are going to be impacted by you spending more time doing those things. And so that is a process of incorporating all of those aspects into your daily life.
Yeah. Well, I think we miss how important, like, the stick to itness is, right?
Yes.
Adherence, or what can I do sustainably? What can I do consistently? That is so foundational, because if you don't like the program, if it's just this major departure, and you can white knuckle it for a little bit, but
Yeah.
eventually those old routines, those old habits often win out. And so that's a question to ask. And what you're saying of like these new hobbies and these new activities, you don't even necessarily know what are the things that I really love or enjoy.
If you haven't been doing that, you may not know what the activities are that you really like to do.
And so it becomes an opportunity, like, well, let's try different things.
Mm-hmm.
And can we begin with things like, I like to do this. I enjoy doing this, right? I really enjoy hiking, or I really enjoy playing pickleball, or I really enjoy cycling, or whatever the thing is. And then use that to get into the habit of doing regular exercise. And then we can try adding different things in, right? Oh, well, hey, let's try some paddleboarding. Let's try some,
Right.
skiing, or whatever it is. But what I think happens a lot of times, it's like, oh, no, I have to do this form of exercise. I do this form of exercise. I hate it. And then I think that exercise is just not for me, right? I'm broken. I just can't do exercise.
Running is a classic example.
The analogy I used on the Ome podcast was, imagine going into a new restaurant, right? That's different than the cuisine you're used to. And you're just like, give me the thing on the menu that people like think is like the weirdest and kind of the grossest tasting, and they usually don't finish it. Like, give that to me.
Yeah,
and
the
let me try it
most
out.
wild
The
thing
most
on the
wild, like,
yeah.
what's the biggest departure from my current cuisine? Give me that. And then they eat it and they're like, oh, I didn't like that.
I don't like this restaurant.
I don't like this. This restaurant's terrible. Versus like, well, let's just start something that's like, hey, is there something that's similar to what's in my own cuisine that I can try? Oh, hey, you know what? I actually really liked that.
Yeah.
And then you go back and you're like, oh, I'm developing a taste for this now. Like, let me try this new thing on the menu. Oh, I didn't like that, but you know what? I know I like this base stuff. Let's try another thing on the menu. And you try all these different things. And then it's like, oh, this is actually a really good restaurant. Like, I would recommend coming here to my friends.
Well, and your palate can change over time as you develop that with food, right? So my wife used to not like avocados and some other things, and now she loves them and can eat avocados straight even, where she didn't used to. Tomatoes as well, and now she can eat tomatoes with stuff. She doesn't eat it like an apple, like I do.
That's weird.
But yeah, and that's fine. You don't have to. You don't have to like.
You don't have to eat
still.
tomatoes like an apple. Is that what we're saying?
Correct.
Okay.
You don't have to.
Okay. Thank goodness.
But I suck the seeds out and then fill it with hot sauce. And that's how
that sounds more like you.
Yeah,
that's accurate.
Yeah. I love hot sauce. Anyway, so the idea with creating this broader plan, this 30-year plan for their life and lifestyle, and saying, okay, this is where we eventually want to get to, but it may take a few years before you really find the activities that you love to do. It may take a few years before your diet really is all the way dialed in to where we would maybe want it to be. It may take some time for us to really hone in on all of the aspects of health and wellness that we maybe, quote unquote, should be living. That's going to take time, and it's okay to set that expectation with them. And I think it's actually very helpful to set that expectation of, we're going to do some things right now to help you get the weight off. And that's great. But we're also going to do some things that we're going to work on long-term to help this become a lifestyle transition. And some of this may take some time. And so during our time together, we're going to help you learn some of the patterns and some of the behaviors that you need to do, but you'll have to keep working on those outside of this. And this is going to be a longer-term plan because it's not an overnight process. And what we want to do by setting expectations and keeping the kind of end in mind, well, while progressing them from where they're currently at, is we want to avoid false starts by keeping the steps that they're taking right now small enough that they can actually incorporate it, that they're 90% confident they're actually going to do it. It helps reduce that backpack of failures, adding more rocks to that backpack of failures that we all carry around. That's kind of the analogy. We all carry around this backpack of things that I failed in the past. And people who are trying to lose weight or are just starting out with fitness often have a very heavy backpack because it's not a lack of trying typically. It's just a lack of maybe having been successful or finding that pattern that works for them. And so they come into this with a lot of past failures that really weigh heavy on this current attempt, where they don't have a lot of faith that they'll be able to finally do it this time. And so that's the idea, is we've got to take that into account and help them understand that we're not going to have a false start this time, because we're going to start slower and more steady on the lifestyle change aspects of things. So even though we can have GLP-1s and other, bariatric surgery or other things that help people jumpstart the actual weight loss process, the behavior change process still has to take time and still has to be part of the equation, or long term we see people just gaining the weight back and struggling. And so that's the idea, is while we're helping them with the more emergent life-saving phase of weight loss, we also want to make sure we're incorporating the lifestyle aspects.
And it's understandable why we get the false starts, right? It's, okay, I'm really wanting to make an effort again, right? I want to get healthier. I want to lose weight. And there's this urgency with it. Like, I need to be there now. And while that's totally understandable, and the long-term process of like, let's take this small, and this is a process that may take months or years or longer, seems really daunting at the beginning. The difficulty, though, is when we try to do too much too fast, then that gets us in the cycle of false start and false start and false start. And it ends up taking much more time to actually get healthy, or we hit so many of those false starts and we just give up.
Yeah.
And so what we want to do is make sure that this change carries through, and that you're actually able to make those lifestyle changes and have the longer term impact. And the thing to understand too is that while muscle adapts fairly quickly, the nervous system adapts fairly quickly, tendon and ligaments take longer to adapt, joints take longer to adapt, bone takes longer to adapt. And so if we just add on like a bunch of intensity, a bunch of volume, when we haven't been doing much at all, that's a recipe to have some of those injuries, right? Having some more painful joints, or having tendon issues, or things like that. And so what we want to do is move quickly enough that we are actually making changes and giving a big enough stimulus that the body actually adapts, but not so much that we keep it from being able to recover. And so it's kind of this idea of a minimum effective dose, right?
Totally.
And so there's kind of that upper boundary and lower boundary. So below that minimum effective dose, we're not necessarily getting the adaptations that we're looking for. But it's a great place to start, and get people buy-in and get them consistent in doing those behaviors that are going to be sustainable and life-changing in the long term.
Well, so we often try to start out with people where it's going to be effective, right? And the goal initially with exercise, and this is hard for people to wrap their mind around, is that the goal is not maximizing adaptation and maximizing strength and getting there as quickly as possible. It's more about, how do we make it first feel possible again to exercise? How do we make it help them wrap their minds around living an active lifestyle? And so at first, I think making it as easy as possible. And so it may not be effective for the first little bit in terms of like actual physical benefit outcomes. It will be better than not moving at all.
Yeah.
But it may not be the 150 minutes a week of moderate intensity exercise, which we can talk about why that recommendation is not great. But it may not be that yet. It may be 5 minutes a day, and well below a threshold of actually seeing much physical or physiological improvement. And that's okay, because the idea is we're going to put their health first, and the weight loss becomes part of this happy accident, if you will, of leading the healthy, active lifestyle, and especially the last few pounds coming off more naturally. Again, with obesity, there is this, we need to get the weight off just to help them be able to participate and to help save their life in many ways. And so I understand that as well. But when it comes to the conversation of exercise and activity and healthy lifestyle, we got to start small enough that they can get hope that they can actually participate again.
Well, and I want to point out what you said. We're looking at health first.
Right.
And if we're looking at health first, yes, we do want to consider the now. And in some cases, like there's emergent things that need taken care of. And so that's where we use, medications, surgery, things like that. But putting health first also means looking over the long term. And like, I don't want them to just have this now and then go back to that cycle. Like, I want to help set them up for the long term.
Yep.
And so,
Exactly.
we said at the beginning, this is still looking at the future, but it's looking at it in a different way. It's not, the way that we talked about at the beginning is looking to the future. This is ideal. This is all the things they need to be doing, and make them do it right now, versus like recognizing where we want to be and then building in a stepwise process up to that level,
Right.
In a sustainable way. And if we can do it that way, then we end up achieving those outcomes without just putting people into, again, cycles of pain, injury, burnout, and things like that.
Yeah.
And so I just like, this really is a health first message. So obviously we understand, exercise change important now in the future, but what does that look like practically?
Yeah.
So many people, how many times have you gotten the question, like, what does that actually look like? What does progressive overload mean? We talked about that earlier. And I think people aren't quite certain what that means or how that applies. And so I think that's something we want to talk about. Like, what actually is progressive overload? What are some of the basic principles of exercise programming that we want to have, especially when we're considering how do we get this to be something that works for this patient right now in their lives with the level that they're at.
Right. The longevity of it versus the, short-term effectiveness of it, that we can create a plan that is long-term, sustainable, where we avoid injury along the way. And so I love to think in frameworks. I like to think of what's a framework around exercise progression that leads to longevity that's backed by science. And what the science has shown is that starting with the end in mind doesn't always work very well. So I really like frameworks. And the framework that I use for progressing people through exercise progression when they're just starting out is looking first, the most important thing that we build up is their frequency. Can we do something every day? Frequency. And the evidence really suggests that that's the first thing we need to build. And then duration. So we first start a habit and build the habit and make it part of our life and lifestyle. And it can be really small. It can be a 5-minute, 10-minute action every day to begin, because we have to start incorporating this into our life and allowing those who love us and are in our life to wrap their minds around it as well. So we start with frequency. Once we've built a habit, then we worry about the duration of that habit, building the duration out. And so making that longer and longer until all of a sudden this is enough time that it is something that we're seeing some positive benefits in our life and lifestyle. Now, all of a sudden, we're past this threshold of it actually making a difference. And once we get the time and then the duration up enough that we're seeing impacts in our life and lifestyle, and again, it can start super, super easy. I'm talking just zone 2 work type of a thing. Then we can worry about the intensity. So how much weight they're lifting, how fast they're running, getting more technical with their zones, getting more skill specific for a sport or activity. Those types, worrying about the intensity is the last step. And where we often start and burn people out, we'll send people to a personal trainer or, some other exercise guru. And they start with P90X or the classes at the gym or the, things like that start too hard for where that person is at. It's not that program is per se bad. It's that they haven't earned the right to participate in that program yet. And the likelihood of burnout, injury, fatigue is just too high. Versus let's just start out with a 5-minute action and build that into a habit. And then we build that 5-minute action into a 30-minute action. And then a 45-minute action. And by that 20, 30-minute action every day, we're starting to see some benefits. And we're making it part of a lifestyle. And then we can start saying, okay, now with that 30 minutes of exercise, let's try at the end twice a week. We're going to try a little bit faster, doing some intervals of like 30 seconds, and just building that up, that for 15 minutes of 2 of those days, I want you to do 30-second intervals 5-6 times, so that 15 minutes of that, you're fairly out of breath. And we start, just something very simple like that. where it doesn't have to be this major lifestyle shift right out the gate.
Yeah. Well, and what will happen with that, again, you do one of those intense programs, you think like, I should be able to do this. People that are healthy and fit can do this, and I couldn't do this. And so the problem must be me.
That guy's 10 years older than me and he's doing it.
Yeah.
Right.
But again, I love that idea of earning the right to exercise in a certain way. Now, I think you could have some people make the argument of, well, like, let's add duration first. The reason that we talk about adding frequency is because we want to build that daily habit. And this is just part of my lifestyle. I just do something for exercise every day. Because if we just choose specific days to exercise on, then the question when the next day comes up is like, oh, is this one of the days that I exercise? And it's easy to always push that off to the next day. Oh, well, I only do Monday, Wednesday, Friday. And so like, it's okay that I miss this. I can actually just, what we want to do is get in the habit of like, I move in some way every day. One of the questions that Cameron asks his kids is, how did you move today?
Yeah.
And so as we develop that habit of daily movement, again, even if it just starts off with 5 minutes a day, or, I'm 90% confident that I can get up, take a 2-minute walk around my block and come back. I know I can do that. Great. Let's start there with just 2 minutes. But I've built this habit, and then I just start to feel like I want to do that. So what we want to do is have there be more resistance to not doing the habit than doing the habit. And if it's something that's easy that we can do every day, then that just becomes part of our routine and we don't have to think about it. And then as Cameron mentioned, we add duration, we add intensity. We can also add different modes of exercise, right? We know that there's like, we want to have regular cardiovascular training. We want to have regular resistance training. And so like we can start to add on, like I'm still exercising every day, but maybe certain days it's like, okay, I'm going to, do a couple sets of push-ups or a couple sets of squats. Another day I'm going to do those intervals. And so we can start experimenting with those different modes of exercise with different styles and find out, hey, what do I like? What works for me? Oh, you know what? I really like higher reps and lower weight. That works for me. But now I want to try a few reps of higher weight. Oh, I actually really like how it felt. I'm going to incorporate that in. But we've still kept alive that whole time the daily habit of doing some form of exercise. It doesn't mean that we have to do resistance training every single day. It doesn't mean that we have to do cardiovascular training every single day. There are benefits from having regular intervals of both, but it's just, we don't have to do everything all at once. It's just keeping that habit alive. And that's why we want to start with frequency, because we're trying to get something that's sustainable and make this a habit and make it a part of lifestyle instead of just something that I'm doing while I'm losing weight.
Right. And especially early on in somebody's journey, making them sore or too tired or joint soreness or things like that are just big sabotagers. Why would we do something that we know is going to make us feel terrible?
Yeah.
Everybody says exercise makes them feel great. I don't feel great when I exercise. I would say then we're probably trying too hard. We probably need to back off and keep it. And I get that it's not as effective, perhaps, but long term, it's going to be more sustainable if they feel better. And so we start with where someone's at and build from there. And I think that's one of the big key principles that we need to help, exercise professionals and health professionals understand is we've got to start with where somebody's at. And the more we have patience with that and let them build naturally and incorporate these things into their life and lifestyle and wrap their head around it and start seeing little wins, and they can be very small. And that's okay, because they're more likely to stick with it when we have those little wins.
Absolutely. And I just, you said like, it may not be as effective, but again, it's how zoomed in are we on efficacy? If we zoom out, it actually does end up being so much more effective in the long run than some of those other things.
Than the stop-start cycles.
And what we're not saying is that intensity isn't important. What we're saying is that like there's a time and a season. And so like to really get progress at a certain point, you have to have enough intensity that it pushes your body to make those adaptations. But like getting people comfortable and in the habit, and then allowing them to go a little bit more intense and to feel some of that discomfort, that's okay. It's just, well, I've already built that habit and I've learned that my body can respond to exercise and that I can do this. And now I can try some of those other things. It's like for me now, when I, do a good workout and I'm a little bit sore the next day, I like that feeling, right? It's like, oh,
I really got a good lift in yesterday, or yeah.
but this, I feel like this is, every guy will say this, right? It's like, oh, I love the arm pump and the chest pump, but I did leg day and no, it's killing me, right?
Yeah.
It's literally the same thing that's happening. You're having the same soreness, you're having the same pump, you're just interpreting differently, because this is what I associate with leg day. And you got to go walk on those legs. You don't have to walk around doing handstands on the arms, right?
Exactly.
A little more understandable. But it's like, these are things that you can learn to love, right?
Yeah.
When I first started working out, like, yeah, the like post-exercise soreness was not my favorite thing. The nice thing is that like our body adapts and you get what's called the repeated bout effect, and we don't get the same level of soreness typically.
Right.
But it was just enough experience with exercise that instead of dreading that or looking at that as like, oh, this is terrible, like, oh no, like I don't mind that anymore, right? It's reframing that. And we're differentiating like the post-exercise soreness than like pain. I need to get to the emergency level.
Yeah,
right.
right. Post-exercise soreness versus joint soreness, or muscle soreness to the point where it's like, I can't stand up out of my chair.
Yeah.
It seems to be a lot of people's badge of honor when they go to a personal trainer or other people and they can't stand up out of the chair because they're so sore. And the trainer's like, yeah, you got a good workout in. And it's like, but did they? Because no one workout really moves the needle at all. It's about stringing together hundreds, thousands of workouts that we really see differences come in. And so it's about making it repeatable, because that's where change really happens. And so we use the concept all the time about training to train. Before I can get to where I really focus on what are the training aspects and how many sets and reps and all the things, you kind of have to train to train, learn the gym, learn different lifts, learn those things. And that takes time before we're comfortable. We talk a lot about gym intimidation, where a lot of people just starting out on a fitness journey have a lot of gym intimidation, where going somewhere where it seems like everybody knows what they're doing, they're wearing the, spandex or the pump covers and their muscle shirts and stuff like that, and look fit and healthy and active. And that environment for somebody just starting out can be very intimidating. So one of the things that I love about VO2 testing is when somebody is obese and they test in some of the lowest categories, especially the very low category, that actually is seen as a disability by the American Heart Association, American Lung Association. Those ultra low values are below community ambulation standards and community participation standards. And so that's seen as a disability. So when you have somebody in that very low category, you can then prescribe physical therapy for them, and they can go in a medically supervised zone or medically supervised location to be able to start exercising. And so they can get help from somebody that understands comorbidities, that understands exercise progression, and can start them off appropriately slow with more gentle exercise and be part of the system, the traditional medical and healthcare system that helps introduce them into the exercise world. And I think that's such a great bridge into getting them to where they can graduate and maybe go to then a personal trainer and things along that journey. But that's a great way to keep them in the system by having that VO2 max test done. And it can be a submaximal test. That's also a common question. And actually, what we're going to talk about next week on the podcast is how to design submaximal tests for people who are obese. So there's your teaser for next week. But you can do submaximal tests and just find out where are their low end zones where we want them exercising to begin, and make that part of the goal is that we want to improve your fitness enough that we can do a true VO2 max test. So maybe that's one of their first cardiovascular goals is let's, build this habit up enough and help you progress enough that we can do a true VO2 max test. And that can be something fun and motivating that when they can do that, they're like, oh man, I was able to last so much longer on this test and I did better and I got higher in my heart rate range. So it's okay to start out with just a submaximal test, find out where that zone 2 is, and then that's good enough. We found out where kind of that crossover is from, optimal fat burning and all of those things, which really is a signal for we can do this sustainably because we're not dipping into that recovery bucket as much by burning a lot of carbohydrate that we're going to have to eat back and replace and recover from. And so often we can do the testing as a way of helping us encourage them by saying, look, this is all the harder you need to work out. I remember working with this lady that it was like, oh, it looks like, your heart rate range where you were most effective at burning fat on the treadmill during that time, you were only 2.2 to 2.5 miles an hour, which is great. And she was like, what? That doesn't even make sense. I'm just walking. It's like, yep, exactly. You're just walking. And let's build that habit of just walking for right now. And that's okay. Like, we'll start there. And as you build that habit, the walking will get faster and faster. And you'll find that you can stay in your zone 2 heart rate and your walk gets more and more brisk as you improve your fitness. And now those will be good signs and a sign that we probably need to retest and see where your new zones are.
I love that you brought that up. And we've talked about before about how this type of testing puts you on the same side as the client, right? And helps you to build the story of what their life looks like, what their fitness looks like. And then it can be an opportunity to ask deeper questions. So while many people feel gym intimidation, they don't necessarily feel comfortable talking about it. And so if we can have those conversations with our clients and say like, okay, like what in implementing an exercise program, what feels like the biggest obstacle to you, or what are some of the biggest obstacles for you?
Such a great question.
Is it time? Is it gym intimidation? Like I don't feel like I know enough. I don't feel like I know how. I feel like I should be doing these things. And then as we dive into that, it can help us to ask further questions, right? We ask questions, we do the testing, and that helps us to ask better questions and to go more in depth and find out like what is going to help you to succeed.
Yeah.
Because if I just am like, oh, well, you need exercise, and I'm just going to give you, like here's this cookie cutter exercise program, go and do that. Well, I don't have access to a gym. I don't have the time to do that workout. I don't, I'm not familiar with the equipment. All those number of things that might be like huge barriers that we never even discovered. And so if we can figure out like, what are this person's constraints? What's going to help them, or what's going to keep them from being consistent? What do they have access to in terms of like money, time, etc.?
Exercise equipment. Do they have a treadmill at home that's holding a bunch of clothes right now?
Yeah.
What do they have access to? All those questions are so good for helping create that first action of like, what's the lowest barrier to entry step we can take?
Yeah. And it can be something so easy. Hey, just walk.
Right. Like just out to the mailbox and back. And we're going to do that, 2 weeks in a row, out to the mailbox and back. And then the next 2 weeks after that, we're going to go across the street. And the next 2 weeks after that, we're going to go across the street and down the block. And then we're going to go around the block. And then we're going to, and just build up in something that feels very doable for them.
Yeah.
That, I can do that every day. And the next thing you know, they're walking a couple of miles every day. And now it's starting to make a difference. And we started below where it's going to make a difference. But because we built the habit and they were able to buy in, now all of a sudden we're seeing progress. So that in 6-8 weeks, we're actually to a place where we can see progress. Whereas before it was they'd work out for a few times, get sore, get tired, and quit. And then we'd re-encourage them and they'd go out and go a few times and they'd get sore and tired and quit. And we're 6-8 weeks in and we've, hit the restart button 10 times. Yeah. So if we can just help them take those minimum effective dose steps, and maybe even below minimum effective dose, where we're titrating up. It's very much like titrating medication. We're titrating up to see what's the dose that they'll tolerate, not just physiologically, but socially and time and, all of the other aspects of their life that become impacted by them spending more time here.
That's such a good point, because like take for example the GLP-1s. You could be put on a dose that makes you lose weight so fast,
right?
But you're nauseous the whole time, right? You can hardly participate in physical activity because you feel so awful. Like we don't just go straight to the maximum dose and be like, good luck.
Yeah.
But we do that with exercise, and we should look at exercise as a prescription, right? We're prescribing medicines with a specific end in mind. wanting to have specific effects and controlling the side effects. Like, why don't we look at exercise prescription the same way?
We talk a lot about how exercise is medicine, and that's been a big push. I know within the American Physical Therapy Association, within the ACSM and NASM, have all kind of used that phrase of exercise is medicine in some way, shape, or form. And I'm all about that. I do believe that exercise is medicine. We've talked about that before, about how if exercise were a pill, it would be seen as the ultimate poly pill, where it positively affects every single body system. And so, yes, it is the most effective pill we can take or medication we can take, but it's how do we create that titrating on of the dose so that we get the right response eventually.
Yeah. When can you imagine if someone was like, oh, you need blood pressure medication.
So give you a horse dose of
or just like go out and get some. Go out and get some, heart medication, blood pressure medication. Like, you need exercise. Go out and get some. Like,
we often do that, but it's often not the provider's fault.
Totally.
It's a lack of really being educated in that. So what dose to prescribe of blood pressure medication, because that was a major part of your education and progression through medical school and all those things. You've been able to work with lots of patients where we've done that. And unfortunately, exercise progression and exercise response and all of those things aren't part of our medical education, unfortunately.
Yeah.
And even in physical therapy school, we learn a lot about dosing for comorbidities, dosing for specific injuries and things like that. But dosing for life and lifestyle is becoming more of a topic in physical therapy school, but was not until fairly recently. And it's unfortunate. And so people would have to go out and learn that on their own, which many physical therapists do. A lot you'll see with CSCS and other credentials, which is great. But unfortunately, within traditional medicine, that has not been an emphasis. And hopefully will continue to trend in that direction.
Yeah. And that's why we're having conversations like this. And I appreciate you bringing that up, because I absolutely don't want to, bag on busy clinicians that are doing their best.
Right.
And so it's developing referral partners that are going to, that you can have confidence in, that are going to consider people's lifestyle, that are going to consider their constraints, that are going to figure out like what are individuals willing to do, what's realistic for them, like, what do they enjoy, what do they not enjoy. One of the things that I will often ask people is, it's like, are there exercises that you absolutely love? You're like, I love doing push-ups, or I love doing squats, or I love doing burpees. Said no one ever, but maybe someone.
Right.
But what do you like? And then, are there any exercises that right now you really don't like?
Right. I like to start with people's activities.
Yeah.
What are activities that you enjoy doing?
Absolutely.
Because it makes it more enjoyable. And then reframing exercise into, how do we use your exercise to help you become more fit for the activities that you love to do? So let's say, man, in high school, I really love playing basketball. Well, going back out and hitting the basketball court is a great way to get injured often. As entry step one, especially if you haven't played for a while, but saying, hey, maybe start shooting around again as part of your activity. And then, what are some exercises that we can do to help you get ready for basketball again? Maybe some overhead, exercises, things working on your shoulders and stuff for your shot. Maybe some squats, some calf raises, things for jumping and running and sprinting and cutting. And so, what are some strength training exercises we can do to help you prepare for the activity that you enjoy? What are some cardiovascular exercises we can do to help you build the conditioning that you need for the activity that you want to do? What are some plyometric exercises that we can do to help start getting your tendons, ligaments, bones attenuated to the loads we're going to be putting on them in the activity that we're going to do? And so it's about starting with where they're at, finding what they love, and saying, okay, let's build a plan to get you back to doing the thing you love. One of our long-term patients was one who came to us. She said, I used to run and I used to ride horses every day. And when she got back on a horse for the first time, that was such a game changer. So she'd lost some weight. She'd done some, quite a bit in changing her activity levels, her eating patterns, all these things. And it was so fascinating when she first came into me, and I've had this conversation with her several times. When she first came into me, I don't know that I'd ever seen a more depressed person, a more just this dark aura, if you will, around her. She just had this Eeyore vibe of like, everything is bad. Thanks for noticing. But that Eeyore vibe, and that changed gradually. And when she got back on that horse, got back on that pony, right? It was amazing, the transformation that she'd made from when we started. And when the next visit we had, when I pointed that out to her, like, do you understand the different light, that the different presence that you have, the lightness in your eyes and everything between who you are now and who you were? And she's like, yeah, I actually do recognize it. It's amazing. And those moments are so fun, but it's because we took time and allowed her to adapt to that allowed her to be able to even hope to get back on a horse. And so this is so fun. And then she started competing again, which was really fun, doing dressage and other things. And so to take somebody that had no hope of ever moving again and get her to where she's running. And that was another thing. She started running is a continuum. So it started with the slowest walks ever and built into, eventually she started jogging. And then eventually she ran like the fastest mile that she'd ever run in decades. And the fastest, she eventually did a 5K and did the fastest 5K that she'd run maybe ever in her life. I can't remember if she said that, but ran like a decent time for her 5K. And it was so fun for her to actually be able to sustain a 5K. And so those progressions started really small, and running was really just a walk at first, like 2 miles an hour walk. That's okay. But she eventually got there and got back on the horse, got back to walking and jogging and running. And it was awesome. It was fun to see.
Well, it's starting where people are at.
That's exactly.
It's all we have to do. And it can look different for every person. One of the other things for that particular individual was what helped her to buy into certain exercises was, oh, I would do this when I'm, working with my horse, or when I'm feeding my horse, or, oh, I used to love ballet. That's very much like this movement in ballet. And so it was like what were just kind of boring exercises before now became like, oh, this is going to help me do the thing that I want.
Yeah. And one of my favorite things to do is to go through their exercise or their activity. So like horseback riding, and be like, okay, so in horseback riding, do you find that, or what's sore when you're done? Or do you find that you have soreness, weakness, discomfort anywhere? And it's like, yeah, my legs from kind of squeezing the horse and whatever. Okay, so let's start with then some exercises for strengthening your hip, ab, and adductors. Oh, perfect. Yeah, that would be so helpful. My abs are usually sore. I'm like, perfect. Let's do some core strengthening stuff. And so when you can bring it back to what are the activities they're doing, what are some of the things that they feel like are shortcomings in that? Like, oh, I used to play basketball and my cut used to be really good. I used to have some pretty good moves. I just can't cut anymore. I'm so slow defending and then making moves to the hoop. Okay, so let's design a couple of exercises in your program that help you learn how to cut better again, or that give you some more of that agility. So when it's based on things that they're looking for, we really can help them buy into, now exercise is not a punishment for eating, for my food choices. It's not because I'm overweight. It's not because I need to exercise, because everybody should be exercising. We stop shoulding on ourselves. And instead it becomes about, what are the things I want to do and how do I get to be able to do them again?
Yeah.
And when we can shift that mentality and get it back to, this is me taking care of me and doing the things that I want to do again, giving somebody exercises on how to get up and down from the floor when they want to play with their grandkids again is so fun, actually. Like, squats become about getting down to play with your grandkid instead of squats. Nobody likes to do squats, right? Deadlifts, picking stuff up off the floor, picking up your grandkid from the floor is just a deadlift, right?
Yeah.
And so let's work on deadlifts, but couch it in, we're going to do a more of like a goblet squat style deadlift, where it's a kettlebell instead. So they can visualize them picking up their grandkid. And your grandkid weighs 35 pounds. So we're going to start with a 15-pound weight and we'll build up to that 35. And then we're going to go well beyond because that grandkid's growing up. Right. And so that idea of like just progressing it for where they're at and what their goals are makes it magical.
Well, I think that helps so much with buy-in. If the person sees the purpose, if they see how it applies to their real life, then it's much more effective. So often exercise is framed as punishment for quote unquote bad behavior. And that's just really demotivating and disheartening.
Yeah.
You know,
I got to go burn off my dinner last night. I got to burn off that cupcake that I had or whatever. Yeah.
Well, and just the way that we look at weight loss, at exercise, at so many things, if that becomes the focus, then we can get frustrated when we don't see the progress that we're looking for in the exact ways that we're looking for because we framed it, right? Oh, exercise should be helping me lose weight at this rate, or exercise is a punishment for bad behavior, or any of those things, versus no, what you said, exercise is about tuning up our bodies so that throughout the rest of the day, we're able to do all of the activities that we want to do. It's the work that fuels everything else that we do. And obviously, you know, if we can help people do that sustainably, and that's going to be another way to get them to buy in. Like, this is the first time in my life that I haven't felt totally terrible every time I exercise. I guess exercise is something that I can do.
Yeah.
And so that brings me to some mistakes that I want to talk about that people often make with this. Before we go into that, though, I do want to comment on what do we do for providers who, like, I think we can say for the majority of providers, like, they care deeply about their patients. They want a better life for them. Like, that's why they got into this field. That's why we got into this field, was to help people live better lives. And yet, what do we do for people listening to this that hear this, that kind of jibe with this message? Are like, I have such limited time as a provider. Like, what do I do? How do I actually help people with this? How do I implement the things that you guys have talked about on here? Like, what does this look like in real life? You know, these are great principles, but in a system that doesn't necessarily support health and longevity, right? That's often dealing with like acute crises. How do we help people? And I think one of the big things is consuming education like this can help. Finding experts in the field. So great people some great people to follow, to look at their work in the field of resistance training would be people like Stu Phillips, Brad Schoenfeld, Menno Henselmans, Lane Norton, Jeremy Lenicky, Lauren Colenso-Semple for women. She's a great resource. So finding those experts in the field that give consistently good information, and that you want to find experts that are willing to say, it depends. You know, that are willing to admit what they don't know. And so consuming content by those people can help you develop a framework. But then also just working to build relationships with like, if you don't have the time to develop these skills, which is totally understandable, not everyone will, finding referral partners that you trust, right? And that can involve asking other clinicians, you know, can you talk to people within your own, you know, medical system, and begin to find people like, hey, when I send people here, they get better. And they don't get just better now. Like, they come back months later saying, I feel so much better. And so in some cases, like, does it take a little bit more legwork at the front? For sure. But once you find that partner, like, then that becomes a really easy pipeline that, you know, like, I'm still taking care of this person and I'm putting them into good hands. Or, you know, even leveraging AI, you know, you got to be careful. But can I, you know, if I do have the knowledge and skills, but I'm time crunched, can I use that knowledge and skills and build a custom GPT where I give it rules, right? I want you to base programming on the best, most scientific principles, and like, help me develop a plan for this person. And then that can take some of the initial, like, oh man, I got to write this program off. And then you can kind of vet that. Does this actually look good? There's different ways that we can use AI. Or like, hey, who are good providers in this area that have consistently high ratings for these things? Can you leverage AI for some of those things?
Create that network.
Create a network. And then just getting really good at asking the next best question for that person. um, and based on their answers, okay, like what next question does that lead me to? And if I don't have a good next question, then that means I probably haven't understood the client. And so it's what do I not yet understand for you? Help me understand and listen to what they have to say.
Yeah.
Um, and obviously like that's a skill to develop. I feel like Cameron is so much better at me than asking like the right questions, but I've learned a lot from him. And so seeking out mentors as well. Like Cameron has been a great mentor for me, and he's helped to frame my thinking so that I've gotten better at asking the next best question. And so finding mentors that can uh, show you that process.
I have to apologize to Marc all the time for how I've polluted him. So
Ruined me. No.
Yeah.
But yeah, there's lots of ways available, even with limited time, limited resources, to help people and to implement these principles. One thing is just as you're listening to this, if you have any questions, please, on our Instagram, send us a message, make comments for the videos. Like we regularly take comments that people leave and we incorporate them into episodes, often make full episodes based on those comments.
Yeah.
Because they're really good questions and like that makes it more meaningful to you. So please, if you have questions about, specific situations or different things, drop those in the comments and we'll see them and we're happy to address those.
Yeah, we love comments. So please drop comments, questions, so that we can address those things and help kind of everybody be on the same page. So I love it. And if you have that question, there are a million other people that have that same question. So yeah. So let's dive into some of the mistakes. A lot of these mistakes, again, aren't necessarily the provider's fault. They're things that we don't know what we don't know, or we don't have time for what we don't have time for, or things like that. And so, yeah, take these with encouragement rather than blame. Yeah,
absolutely. And this is going to be a review of a lot of the things we've talked about already, but just to make it a little bit more salient. So mistake one is prescribing for ideal physiology rather than real life, right? We talked to that point. There's the ideal, the perfect program. The perfect program is the one that someone will do and that they'll do consistently.
Yeah, that they'll keep doing.
And that can look very different. And even for that individual, at the phase they're in, that can look different, right?
Right. It'll look different now than it will 2 years from now. And the key is that we progress 2 years down the road, that we're sticking with it enough that we make that progress over time.
Absolutely.
Yeah. Mistake number 2.
Yes.
Is promising big weight loss or big changes from just exercise alone or one thing alone. The exercise gets, touted as something that you can do. And we always say you actually don't lose weight from exercise. Exercise is what tunes up the machine so that your body can be better at using calories. And it's your lifestyle and activity and you're keeping a high RMR, all of those things. That's where weight loss really comes from.
Yeah. And again, it's not that exercise doesn't help. It's just that I love what Cameron said is it's not one thing. And I think when we're making changes, and this is more how kind of the framing of influencers, right? You've got to just do this one thing. This is the best thing to do. If you're not doing this, you're failing. And just like making changes is a complex process, right? There's so many inputs that lead to any given result. And so, making those lifestyle changes is going to be a bigger driver, right? We can absolutely leverage tools like GLP-1s, bariatric surgery stuff that help us to get that weight off fast, that help to reduce the food noise and make it a little bit easier to make some of those lifestyle changes. But without making lifestyle changes, without finding a program that we can stick to long-term, most people really struggle with maintaining weight loss. And so building exercise as that regular habit, as we talked about, something every day, and something and having some guidelines, right? I do something every day. I move every day. Something is better than nothing. I don't have time for my full workout, but I can at least do something. I can do a few push-ups. I can do a walk around the block. I can do some squats. And just framing it as like, this is just a part of my lifestyle. I just do this every day. Then that helps us make positive changes over time. And it's just making those little changes in a sustainable way that we can see crazy impacts. I'd love if you tell the story briefly about the friend that lived nearby you, the 85-year-old guy that like I remember you were talking to him and he told you
Oh, yeah.
about like the crazy life he'd had and where he was today.
Yeah. So, yeah, as part of a neighborhood party, actually, one of the tasks was to go interview. It was kind of fun. Interview an older adult in the neighborhood, and it was part of a Halloween party, like a Halloween scavenger hunt, and so it was kind of fun. And so we went and visited this guy, and he had led a great life, but a tough life at times. Um, he had lost 2 wives to cancer, had 1 divorce, and just, had kind of a hard living, hard drinking life early on in life. And then, um, yeah, anyway, just had lived life, and some of it didn't go so smoothly, like most of ours don't. Um, but he is this amazing man now, and he serves at the jail and volunteers a ton of time, and he can still do like 20 pull-ups, and uh so physically he's just this machine. When his third wife second wife was dying of cancer, he started weightlifting, and he got, at 55 years old, he got to where he could bench like 365, I think. Just, absolutely strong. And that's what he would do. He would drop her off to get her treatments, and then would go to the gym while she was working out, because he's like, I just couldn't stand to be there. It was too hard. And so then he'd come pick her up afterward. And he um, just anyway, he said to us, all these, just taking little steps every day. He said it's amazing how far you can come in 85 years. He said, I never did any one big thing to change my life. It was just a bunch of little steps that eventually added up to now who I am as an 85-year-old is pretty awesome. And it was fun to hear him talk about that. Like, he is an amazing guy and just a good guy. He serves so much and so many people, and does so much good in the world now, but it took him some time to get there, and that's okay.
Yeah.
Like, that's part of this life journey. And so often, so that's mistake number 3, is starting out too hard. And often that's what we do. We start with trying to be the 85-year-old, and all the things that he's doing, volunteering and being able to lift a crazy amount of weight, and trying to do all those things from the get-go, versus saying, here's where I really am right now. Here's where I want to be, but here's the next step that I can take to start to get there.
Yeah. Well, and this is in all areas of life, it's a capacity issue. It is not a like character issue, right?
Mm-hmm.
Like, you don't have enough capacity, you're terrible. Like, that's not true, but that's what we often think.
Yeah.
I can look at all these other people that can do so many things. Why can't I?
Yeah.
Why can't I be there in the ways that I want to? Why can't I, exercise in this way? Why can't I go do this? And so we just heap shame on ourselves for what's just a, a, a an addressable issue, but just a temporary capacity issue. And as we go slowly, as we build, we grow capacity over time. I remember the guy saying that, like, sometimes, like, in a given year is maybe a 1% change,
Mm-hmm.
but after 10 years, like 10%, 20%, right?
Yeah.
And like 50 years later, I've made this huge change. And if I'm doing any, more in a given year. And so it's just like, it's okay if you're not there right now. It's okay to start with where you're at, because that's where you have to start.
Yeah.
Like,
Yeah.
what's the Mary or the
Not Mary Poppins,
sound
but
of
Julie Andrews.
I made that
Yeah.
mistake earlier.
Start at the beginning, for it's a very good place to start.
There you go.
Yeah.
And just like focus on those habits, focus on building that framework that supports the type of life that you want to live, and then grow your capacity over time. It's so possible to grow capacity. We just often run faster than we have strength, and then feel like we've failed as a result. But it is possible to grow capacity. And one concept I love is the concept of the gap in the gain, popularized by Benjamin Hardy. But what we often do is we look at that ideal. This is where I want to be. This is where I should be. And I measure everything against that.
Mm-hmm.
And that just is a recipe for feeling like frustrated and feeling like a failure. What he talks about is, like, where am I today? And then looking back, like, where have I come from? Where I was before? Like, what do I know now that I didn't know before? that's enabled me to make better decisions, that's enabled me to do different things.
Right.
That's, what capacities do I have now that I never could have dreamed of in the past?
Right.
And yet, through that steady, consistent effort, I've built that.
Right. Measuring ourselves by the gains that we've made versus the gap that we have to be where we want to be. And I think that's really important that we do that. Because I think, and this, it's all coming together. Mistake number 4 is we often confuse exhaustion with progress and effectiveness. And just because my workout made me tired doesn't mean it was the most effective. And so, really, to me, the most effective workout is the one that you can do on repeat. So if you get done with your workout and think, man, I didn't work that terribly hard, I could do another one again. It's like, yep, that's the point, because tomorrow you're going to do it again, and the next day, and the next day. So I'm okay with somebody like kind of giving it a half effort today, as long as they did something today, because then they'll do it again tomorrow and the next day and the next. Whereas if they push hard or go after that one more rep or that one more thing, and they get injured or fatigued or feel too beat up, then they're less likely to stick with it. And so I would rather somebody, sometimes give it more half efforts, but still do something, than do nothing at all. And that's the thing. Exhaustion isn't necessarily always effective, and especially if we're talking like zone 3 exhaustion. You're just dipping into that recovery bucket and never giving yourself a chance to actually recover. So,
Well, as you mentioned before, it's not one workout that changes things. It's, can I string together a
right,
series of workouts that begin to change things? And what Cameron, like, I want to be clear, like, what Cameron was saying is not that you should never go high intensity,
right,
but it's times and seasons. And so it's like, it's this form of auto regulation. There are days that, I have something planned for the program and I actually feel amazing and I can push a few more reps, in strength training, or I can go a little bit harder. And then other days that it's like, I didn't get good sleep last night. I'm really stressed about this. Like, I'm not feeling the same intensity as what's programmed. Like, that's okay,
yeah,
and it's just building that over time and then in the right amounts. And so, like, for cardiovascular training, right, having that big base, a lot of zone 2 is very helpful, but we do want times where we go really intense. Zone 4 and zone 5, we're just not doing that every day,
right.
because we want our bodies to be able to adapt.
Yeah, like when I've been marathon training, there have been days where I had an hour run planned, and I'm 20 minutes in and I go, not today. Like, I just don't have it in the tank. And so I, slow down, walk back home, whatever. I kind of mail it in, and that's okay. And there have been days where I had an hour run planned and I do an hour and 15 because I'm like, oh, I'm actually feeling really good. And I'm able to stay in my zone 2 really, really well. And so I'm just going to cruise a little bit longer. There's this new trail that I saw that I kind of want to explore, or whatever.
Yeah.
And I go a little bit longer. And so that's okay on both of those, as long as I, appropriately adapt if I go a little bit longer for that, in terms of calories and all the other things. But yeah, it's important to listen to your body, I guess. So that's mistake number 5 is ignoring joint tolerance, fear, and recovery. So not honoring the fact that this can be hard or fearful, and saying what are easier barriers that I can do, and ignoring joint pain and joint problems. I'm a big fan of keeping moving. I think it's a form of malpractice by telling somebody to not move, telling a runner not to run, versus how can we run, or what can we do to um, mitigate symptoms and run in a way or at a volume or duration that doesn't cause increase in pain and things like that. But ignoring joint pain and just pushing through the pain is not a good idea either. But making sure you have sufficient time for recovery, that your joints and muscles and everything feel healthy and good. I think all those things are really important, and mistakes we make if we try to push through.
Well, one thing that we always say is the only training that matters is training that you can recover from. And so we want the stimulus from training, but we also want the recovery.
Yeah.
And just understanding, like, what your client's going through and what they're feeling. What are some of their fears and how do we work around that? So I was working with someone that, like, has had shoulder pain for a while, and, like, they really want to lift, and they'll lift and then it'll just start hurting again, flare up. They can't do anything with it and they just get frustrated. And so the conversation we had is, it's like, let's work on some things to just get that arm moving, turn down the volume of the pain. Like for your other lifts, you can lift really heavy, you can go really intense, but we're just going to go a little bit lighter and get you moving so that you can, like, just your daily life, your just general pain level is lower, right? We begin to build tolerance in that tissue. And now, like, still not doing tons of weight, but able to lift, like, so she was able to just move her arm through a limited range of motion. And then she started getting full range of motion. And then she started adding a little bit weight, started with like 3 or 5 pounds. Now she's up to doing 10 to 15 pounds on certain lifts.
Yeah.
And pain-free.
Yeah.
Or very minimal pain. And she's just like, oh my gosh, like, I know I want to be here, right? Like, I really wanted to grow muscle and have that be my emphasis, but that I can just not have pain for the first time in however long is so nice.
Right. And it's not that you avoided using her shoulder. So I've had that too, where I had a patient with a shoulder thing that every time he did flies, it hurt. And so he stopped doing flies. And I was like, well, why did we stop doing flies? Versus just back off to the weight that you think in your head needs to be what's going to help you progress. Like, let's just back off a little bit or try some different fly variations, incline, decline, whatever, so that we're using it, stressing it slightly differently, find ways that we can still hit that until it adapts and grows and its capacity increases, and all of a sudden we can do flies again.
Yeah.
And so a lot of it is not avoiding the activity that hurts. It's just adapting that to where they're at and what can we safely do, and then build that back up.
Yeah. Or another thing, like if people have had a bad experience with certain forms of exercise. So it makes me think of running for you. Like Cameron loves running now. That was not always the case.
I hated running. I'm an adult onset runner. Yeah, running was a punishment, right? And I played a lot of team sports growing up, and running was the punishment. When you screwed up, you ran laps. When you screwed up, you ran. I hate that now. When coaches do that, I'll talk to a few of my kids' coaches and been like, hey, let's not do that, because running should be more about what's the competitive advantage I can have on other teams and things like that. And so, yeah, I came to that late as I realized, oh, running doesn't have to be go and run as hard as you can. Running can be, I feel like walking now. And so you walk, or, whatever pace. I think I've told that story on the podcast before, running with my wife one time on a longer run, like, is not long, but 8 miles. It's all relative, I guess. Went on an 8-mile run with her, and she's like, I can't believe you can just come on an 8-mile run. And I was like, well, yeah, if you run this slow. She said, well, what do you think distance running is? I'm not running fast the whole time. I'm just running sustainably. And then I do bouts where I run faster to help my overall time get faster and whatever. And I was like, oh. And I quite enjoyed it because it was just a trail run and we were plugging along, not too fast. Every running experience I'd had prior to that was run as hard as you can for the amount of time that you're going to run for.
Yeah.
And so I remember for a baseball tryout in high school, it was a 30-minute run and you had to count your laps, and then you turned in your laps to the coach at the end. And I think I doubled everybody. I think the next closest person I doubled. And because I was like, well, let's see what I can do. And I want to like prove to the coaches. And I ran so hard the whole time and just like was borderline puking, but I could sustain it for that one time. It was miserable. And so that's what I thought running had to be. Right. And so anyway, the idea of just progressing that instead as where people are at, and helping them to be successful long-term versus forcing them into something that they don't enjoy.
Absolutely. Okay. No segue into mistake 6. So we'll just go with it. And that's failing to celebrate non-scale progress.
Yeah.
And this is huge. So one of the things, we've talked about so many times on the podcast, how important exercise is, how it really tunes up the body. The amazing thing is, without seeing, obviously, as we're losing weight, we want to actually lose weight over time.
Yep, absolutely.
But even before the scale changes, we can have positive adaptations occurring. And independent of weight loss, improving your cardiovascular fitness, improving your muscular fitness will have big impacts on longevity, right?
Yeah.
On risk of dying from any cause.
Right. Changing body composition, changing cardiovascular fitness, changing your RMR, or at least preserving your RMR as you're losing weight, is a great signal of I'm improving not only muscle mass, but muscle quality, that I'm able to um, have that muscle be more efficient at burning and using calories and things like that. So we often, that's harder to assess muscle quality. Is this marbled meat, right? Where a lot of fatty infiltration and things like that, and lower mitochondrial efficiency and density and all of those things that lead to that muscle being more metabolically active. That's harder to measure. And one of the ways that an RMR and looking at certain aspects of a VO2 test, looking at overall calorie burn at each stage and things. As we see those things improve, that really signals improvements in muscle health. And so we can celebrate some of those wins, even if it's not weight on the scale as much, especially as somebody gets closer to their goal weight. We're going to see fewer, they're not shedding pounds as rapidly as they were. And so we look for a lot of those kind of non-scale improvements to say, look, your VO2 max improved by 2 points, your RMR, stayed about where it was last time, which is a huge deal to not have that further drive down. Your zone 2 grew by 5 beats per minute. Your number of calories you burned in zone 2 grew by 100 calories. All of those are huge wins in being able to make it more sustainable and more successful, all of those things.
Absolutely. And also, so like there's some really good quantitative things that we can look at. And then also qualitative. Like
Yes.
I finally feel comfortable going to the beach, or I didn't get left out of my friend's trip because they're all going, hiking here. Or, oh man, I got to walk my daughter down the aisle, or I got to play play with my grandkids and do all the things they love, and I could keep up with them.
I had a lady say, I've run every day for a year. I haven't missed a day. And this is the first time I've ever been able to do that without an injury or without knee pain. First time ever. I was like, that's amazing. Yeah, that's such an awesome thing, because she was able to respond to her body. And that's a huge non-scale win.
Absolutely.
Yeah.
And so bottom line is it goes back to, how do we help people have more of those moments? How do we help them make progress, improve capacity, while also allowing them to recover and build it into their lifestyle? Again, when we look at the most successful diets, when we look at the most successful exercise things, there's not any one that just is like, this hits the top of the list. It's what could people stick to? That's going to be a little bit different for each person, given, their specific context, given their constraints. But that's kind of the bottom line, is how do we help people through the process of behavior change?
Mm-hmm.
Because that's often the more difficult part, but that's also the part that can bring so much joy into people's lives as they recognize, I can change, I can do better, I can expand my world instead of having it contract as I age.
Yeah.
And so just having an understanding of some of these things and starting with people where they're at can be the first step in a journey to better health and ultimately, like, better quality of life, better relationships.
Well, so we were nervous with this topic about not having like a here's your printout for exactly how to prescribe exercise and build a program for somebody that's just starting out in their fitness journey, and for people that have been battling obesity. There isn't really a cookie cutter way. Unfortunately, there's not. Here's your PDF of like the method. Instead, it's here's some principles that can guide you, and you have to use your clinical judgment and your kind of understanding of that patient. And just I would encourage, ask lots of questions, and I know time constraints make that difficult, but ask lots of questions and help them discover what's that next 1% step, that 90% confident thing that they'll actually do, and just build off those little wins as they accomplish thing after thing, instead of piling it all on at once and just having it be one more thing we add to the failure backpack.
Absolutely. And again, as far as questions go, if you have questions, please drop them in the comments, send us an Instagram message. We want, our goal is to really help our listeners and give you actionable advice. And so if there's things like that, please feel free to drop that in the comments. As always, remember, if you want more content like this, remember to like, follow, and subscribe, and we'll catch you next time.
Ready to take your metabolic testing to the next level? Visit KORR.com to learn more about purchasing our metabolic test equipment.